Doctor, what is the likelihood of this being contained before Christmas?
Hi, Danica. This is still very early in the outbreak, so the next few days are going to tell us the extent of it. And as we heard in the introduction there, important factors will be how many cases are outside the Northern Beaches area, how many are unlinked. And that might take a few days, so I can't necessarily see the restrictions being lifted before that Wednesday midnight.
Do you think that Greater Sydney now could potentially face further restrictions?
Yes, so that's going to be one of the hard decisions. If we're seeing in the next few days exponential growth, a lot of cases outside the Northern Beaches that are unlinked, then a lockdown of Greater Sydney is possible. Now, that may not eventuate. New South Wales Health has a great record with dealing with COVID outbreaks, but it's certainly a possibility that has to be considered.
How big of a risk is Christmas? We know there will be family gatherings, family parties. What is the probability of this potentially becoming a super spreader?
Well, the good thing about Australian Christmases is that we can have them outside. And we know that transmission of COVID outside is about 20 times less than inside. And interestingly, if you look at the US data from Thanksgiving, it's hard to work out exactly the impact of Thanksgiving. We assumed there'd be a massive increase in cases. It wasn't necessarily the case. The states that were doing worse continued to do worse before and after Thanksgiving, and those that weren't doing too badly didn't change too much after Thanksgiving. However, you've got large groups of people indoors if you are having an indoor occasion, and there is the possibility of a lot of transmission. So if you are sick, do not turn up to your Christmas party, or make sure you get tested and cleared before you do so.
Yeah, some good advice. There's been a lot of discussion about the wearing of masks. While it's currently strongly recommended, it's not mandatory. Do you think it should become mandatory? Is that a strong line of defence?
Danica, I think mask wearing should be mandatory. It has been shown to be safe, effective and cheap. And it's one of those measures, once the outbreak is under control, you can stop mask wearing. But bring it in, make it mandatory. We know from earlier in the year, only about a third of people wore masks when it was recommended. Therefore, making it mandatory will make people more compliant.
We know at this stage patient zero still hasn't been found. We don't exactly know how this cluster first started. As time goes on, is it the case we might never know how the infection began?
Absolutely. We might never find out how this outbreak started, but as with South Australia, as with Victoria, it is most likely linked to overseas travel, and that is always going to be the biggest risk for Australia, spillover from hotel quarantine, overseas travellers into the community.
And overall, have you been impressed by the way the New South Wales contact tracers have handled the outbreak so far? It's at about 68 today. That number is, of course, expected to rise. But do you have faith that they are on top of this?
Look, Danica, the New South Wales health response so far with COVID has been very good. They've dealt with clusters very effectively. They've got a very good contact tracing system. But of course, like any system, there will be a point at which they will get overwhelmed. But of course, they know their system, and they will hopefully recognise when that's the case, and they will take appropriate measures when that happens. But hopefully it won't.
Fingers crossed. And just finally, given the current rate of infection, where do you expect case numbers to be at by the time Christmas comes around?
Look, this is the great unknown, Danica, because we really, at this stage, are just trying to tease out the extent of the outbreak. So we might find in the next few days that we're heading towards very low double figures and then even single figures. But on the other hand, if there has been a lot of transmission that hasn't been recognised yet, by Christmas we might be seeing exponential growth. And that's the nasty thing about this COVID virus and the outbreaks that it causes. But let's hope for better rather than worse.